welcome to the We Talk Health Podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com, and we will do our best to answer any questions you may have.
Hello, I'm Dr. Don Wilson, for those of you who don't know me, and this is Amy White. She's our women's health nurse practitioner. And we're here today to share with you guys our vision of what we want to do as far as a gynecology-only practice and kind of give you an idea about what that looks like. Traditionally, obstetrics and gynecology have been combined, but there are a lot of experts out there that are telling us that it does help to have it separated, where obstetrics is the care of pregnant women and delivery, whereas gynecologists and women's health will strictly take care of women that are not pregnant and other times of their life. And that's really what we're focusing on and we're wanting to accomplish, and we want to do it in a way that's nice for our patient.
And convenient.
And convenient. Absolutely. Thank you, Amy. I've been practicing obstetrics and gynecology for 30 years, and the last 5 years have been gynecology only, and the last 2 to 3 years have been thinking about and praying about opening a GYN-only clinic, women's health, and shared that with Amy. And then as we began to go through the process, we were so excited that West Tennessee Healthcare has agreed to partner with us on this venture and be able to deliver this new type of clinical medicine to West Tennessee.
I think we need to let them know some important facts about our office and what's important to us. I think it's important for women to have a person that they can talk to, and easy access to phone us and make an appointment and get in pretty quickly, even same day often.
Yeah. Imagine yourself as a patient of West Tennessee Medical Group GYN Specialist. Being a woman that's proactive with healthcare. So just imagine what you want and what are you looking for in your care with us?
Well, I think patient education is very important. I think it's important that we're easily accessible. I think it's important that we provide resources for patients and their families. I think that we would like for you to know that we can take care of actually adolescents to geriatrics,
Right.
Yeah.
Yes.
So,
well, a neat thing about a gynecology-only practice is that we're able to focus.
Right.
And let's face it, gynecology in of itself staying up to date, and there's so many changes in the specialty that it's a full-time job in and of itself, just staying up to date. And obstetrics was a big part of our practice for years, but this is a new stage for us, a new chapter.
And really a new concept for this area.
Right. To have GYN only it is, and we hope to do it right, and we plan on.
I think it's important to feel like they know the staff, and we've got familiar faces, and
True.
So I think that's important. I think it's important when they walk in the door they feel welcome. I think it's important that they feel special. Right. And that they are in an environment that is aesthetically pleasing and comfortable, so that when you're coming for this oftentimes vulnerable exam, you are made to feel as comfortable as possible. So that's one of our main goals, is really just making the patient feel comfortable
right.
and happy.
Exactly. My daughter and my wife have shared with me it's difficult enough to come to see your gynecologist as it is, and why not make it as nice and personal experience as it can be. We've always said, and I've always told you, Amy, that as long as we take care of our patients the way that we want our wives, our daughters, our mothers taken care of, then we're going to be good. We're going to take good care of those patients. And we want to. Now, we want to be innovative as well. Our office is going to be unique. Part of partnering with West Tennessee Healthcare and West Tennessee Medical Group is that it gives us access. West Tennessee Healthcare takes care of 500,000 lives in 20 counties. We also want to be a referral center for those caregivers that are part of the medical group out there as well. And we think that we can serve that need in a unique way. Of course, it starts with your annual exam and feeling comfortable with the people that are taking care of you. And really, it's about loyalty and confidence in your provider. Between Dr. Ball and Amy and myself, we have 75 years of experience taking care of ladies in the area. And with that, we hope that we have the confidence of patients. I know that we have a loyal following. We hope to develop that even further. Things in the office that we do a lot of menopausal therapy, a lot of hormone replacement therapy, and we could talk about that for an hour or so, and that may be time for another podcast, but we do stay on the forefront with that, the cutting edge. One of our more popular hormone replacement therapies is the pellet clinic, and patients really do enjoy that and the results of that.
So I think what we want you to know as our patients is we will take care of you for your annual exams. We offer any kind of gynecological procedure, basically IUDs, if any type of birth control. We offer Nexplanon. We can even surgically tubal ligations. We can offer that too.
Exactly.
So,
and our office will be set up, even though it's going to be a smaller office, we still are going to be state of the art. We're going to have
ultrasound.
We have been provided through West Tennessee Healthcare and our partner with them, state-of-the-art ultrasound unit. Our hysteroscopy is second to none. We'll be able to manage abnormal pap smears with a brand new colposcope that we have. And so what we're doing in the office is cutting edge. And then there'll be times as well that you're going to have treatments outside of our office, in the hospital, or we're at West Tennessee Surgical Center. And over the years, we have developed a really significant robotic surgery practice. Myself, I completed my 500th robotic surgery just this past January. And not that numbers equate to expertise, but it certainly does help. Our patients are able to come in and have major surgery through minimal incisions. They go home that day and recover is quicker, and they do much better. Actually, we have just moved one of our robot units to West Tennessee Surgery Center. So that's going to be really exciting as those patients flow into that area in a new setting. Dr. Ball is the only gynecologic surgeon in the area and probably the most experienced in the state to perform the gold therapy for pelvic floor relaxation surgery, and it's the fancy words, or it's a robotic assisted sacrocolpopexy. But basically, Dr. Ball is the best, and we're excited about him being able to continue that in our new clinic.
I also think it's important for women to know that we can be a place for you to come and talk about things that go on in your life. You know, as a woman, we're busy, we're mothers, we're wives, we're girlfriends, we're students, we're employees, and I think sometimes that takes a toll on us as a female. And so I think it's important that you feel like you can talk to your healthcare provider about those kind of things, not just coming in for your pap smear, not just coming in for your mammogram, but really so that we can know you and know what's important, you know. And I think in this smaller environment, I feel like we will provide the opportunity for you to know us better and for us to know you better.
She didn't want me to say this, but I tell people all the time that if it was just Dr. Ball and I, we'd be really good. But with Amy, we're great. And I don't just say that. We have watched her grow and evolve into an expert in women's health in West Tennessee. She won't say that, but she is. And it was really important to us to have a female in the office because I understand we've been doing this for 30 years. And there are a set of patients and women, and rightfully so, that would prefer to have a female provider. And we want you to be comfortable in our practice. We want you to come to West Tennessee Medical Group GYN Specialist and leave there knowing that first that you were cared for by competent people, that you were listened to, and that you were offered cutting edge technology and treatments and techniques that are out there in gynecology today. And you have all kinds of places to go find women's health care. And if you're looking for a place that's GYN only, this new clinic may be a really neat alternative for you. You want to talk hormone therapy?
I do. I think it's very important.
Let's talk hormone.
So I think women need to know that the average age of menopause in this country is 51.
Right.
But that doesn't mean everybody's going to go through it at 51. And it is a process, and I think it's important that patients understand that. And it can happen basically 45 to 55, and that's...
Or even from surgery.
Well,
when
that's true.
Patients have their ovaries removed. So, you know, we've got a number of patients that have surgery and have their ovaries removed. So they're going to go through menopausal changes then as well. Menopause is part of aging. What happens is a woman's hormones drop. And as a result, all the symptoms come about. First, their period stops because they don't have the estrogen supplying the line of the uterus. And then with low estrogen comes low testosterone and all the other symptoms that follow. Some women just kind of sail right through it. And typically we see that in families, you know, moms and daughters. But then there's a lot that just suffer.
And they do, and that's when they come into the office and they sit down and they say, I'm miserable, I need some help. I am hot flashing all the time. I have to change clothes, I have to blow dry my hair. Hot flashes, night sweats, vaginal dryness, that's a real problem, and we're very happy to talk about that in the office. Pain during intercourse is an issue. Sometimes even depression and oftentimes anxiety.
Right.
And a big problem with menopause that important to women is weight gain, and I think that's important to know that that's a normal symptom. But
along those lines, it's interesting, and we're going to talk about the actual hormone replacement in a minute. But I just got back from a meeting, and it was with the Mayo Clinic, and one lecture that I was really interested in hearing from the expert was they mentioned that they've actually in studies have shown that estrogen does not increase a woman's weight gain. And that's huge because
that's
some
a big deal
some
because
people worry about, okay, if I'm going to take these hormones, then I'm going to gain weight. Well, the studies show that that's not the case. It's oftentimes where you are in life at that time.
That's true.
That's true. The weight's coming. So we can tell patients about that as well.
Also, with menopause, oftentimes women come in having trouble sleeping and having some joint pain and just fatigue. And part of that goes with just life, but it is sometimes worsened during menopause.
Right. We actually have patients that one of their main complaints is headache.
That's true.
Come in, I'm having headaches all the time. I'm not sleeping. Help me through this. And so that's a big part of our practice. I mean, we're women's health providers. We're gynecologists and nurse practitioners that are focused on women and their health through various stages of life, and our menopausal patients are a big part of our practice. I guess we probably ought to talk about treatment modalities and things like that. We can talk about non-hormonal help for patients. Diet, exercise are crucial in this. But for some patients that's not enough, then we have to go to hormone therapy.
We do, and you can get that in several different forms. Of course, there's always the pill. We can do hormone replacement therapy.
Right. It's been around forever.
Long time, and we'll be happy to talk about that if you feel like that's the best route.
It's a good alternative for a lot of people.
And then there's bioidentical hormone replacement therapy.
Right.
So, and then there's also
that's kind of the potions, pills, and now we got potions.
That's right, yeah. And then we have pellets.
We do have pellets. That's right, and we'll talk about that. But bioidentical hormone therapy is a part of our practice. It's probably a smaller part, but it's a part in that it's not necessarily better, but it works. We have to individualize our patients' therapy. We're not just going to be this big box clinic that one size fits all. And that's what we're looking for in our practice as well. We want to focus on the patient that's in front of us and treat her symptoms the best that we can. Pellet therapy is something that we've been doing for years. The benefit of pellet therapy is that you don't have to take it every day. Yeah, you don't have to worry about absorption from rubbing it on. The pellets themselves are actually about the size of a grain of rice.
Tiny.
The drawback is you have to come see us to have them placed, and most patients come between every 10 to 14 weeks. One nice thing about our new office, it's going to be really nice. It won't be as bad a place to have to come. You stop by the beverage bar.
That's right.
Get you a cup of coffee.
Come Monday through Friday.
Right.
Somebody will be there to do it
Absolutely.
every day.
Absolutely.
Yeah.
And so it may not be that bad of a thing. Go out to eat, go shop, and then come get your pellets.
That's right.
Meet your husband for supper afterwards.
There we go.
That would be good too.
There we
But a little bit about pellet therapy. They're actually quite small. They're the size of a grain of rice. We place two types of hormones. We use estrogen, estradiol, and testosterone. We don't place progesterone pellets because we don't have one.
Right, but we do use progesterone.
Yeah, absolutely. And
we'll
the patients
that if
that
they
we
need
have to use progesterone on are women that have
a uterus.
Right.
If you're getting hormone replacement therapy with estrogen and you still have your uterus, then it's very important that you also have progesterone to support the lining of the uterus, because if you use estrogen and don't use progesterone, it can greatly increase your risk of endometrial cancer, but easily preventable. And
see, I told you. We're really good without her. We're great with her. But back to pellet therapy. We place estrogen and testosterone pellets. And in doing so, pellets are placed in just a matter of minutes, and you go home and get about your normal life and activities. Estradiol helps with certain symptoms, and testosterone helps with other symptoms. You want to speak to
I will. So estradiol is going to be the one that helps you with sleep and helps you with vaginal dryness. Oftentimes will help with night sweats and hot flashes, whereas testosterone will help with the decreased libido or decreased sex drive that often comes with the menopausal phase of life.
Right.
And energy. Testosterone helps with
absolutely.
energy, too.
And energy as well. Now, we're not going to be cavalier about your hormone replacement therapy. We're going to be cautious, and we stay up to date with all the latest studies, and they do change. But as of 2020, we know that our estrogen therapy in the right patient. Now, there are criteria that will cause you not to be qualified or candidate for hormone replacement therapy, and we'll discuss other options then. But if you are a candidate, then we've got
come see us and we will talk about it. We'll sit
pills
down.
and potions and pellets.